Yeah. Prasad garu, please go ahead.
Yeah, I think we welcome you today for this session in the evening, both on the cancer and treatment by Dr. Geeta Nagasree garu. And I request Kavita Rajesh garu to give a welcome address and about HM.
We can start it. 3, 2, 1, we can start, madam.
Okay. Very good evening to one and all, and thank you, Rajendra Prasad Garu. And very pertinent topic is cancer and treatment for women, especially because women really are not considerate about the health, and they give the last priority for health. And I thank our guest lecture speaker today, Geeta Nagasree Garu, who is herself is an oncologist, and she would be briefing us about cancer and treatment, early preventive measures for women on cancer, and how to monitor yourself in case you have detected any changes in yourself. And I also to welcome Madam on behalf of Hyderabad Management Association. It's an organization since 1964. It started with few dedicated managers in the city of Hyderabad who felt the need for developing managerial skills among young executives and spreading the message of professionalism and practicing among the practicing managers with involvement of academia and industry. We do plethora of activities and we provide a platform for professionals, academicians, and management to stay abreast of contemporary management practices and shaping the professional with emerging challenges. And we conduct various activities like today, what we are doing, a lecture and awareness programs and all. And apart from that, we conduct evening lecture meetings. We do training programs and also seminars, conventions, quiz programs. And we also do the faculty and management development programs. And we are also doing various other certificate programs, and we are associated with the business schools. And also we are doing IRP, the third batch, which is all girls batch. And I thank the conveners of the IRP to shaping it very well, and they are giving the skills needed for the corporate world. So we started an MSME desk with the collaboration with Krishna Prasad Foundation Trust. And apart from that, we started various other initiations like international desk to link the institutions and cooperate to international universities and internships and international trade opportunities for corporates. Besides tie-up from different consulates on cultural exchange and also technology through speaker meetings. And also a social impact desk, we are addressing various other problems. Like we started we have one of the mountaineer we are helping to reach, and the second one was on the social impact desk was revival of this water harvesting pits in the government school, and also teaching the students about the importance of water conservation for future tomorrow. It is part of the management this thing also, because my water is being very precious, and the student at the grass level are teach how to preserve water. And also we are associated with IMA. We conduct various programs along with IMA in association. We do joint programs with IMA also. So I also thank Nagasree Madam for accepting this, Geeta Nagasree Garu for accepting our invite and giving us our awareness about prevention of cancer is one, and treatment, what are the treatments available. And also I request you to, Madam, please tell us where a person infected, how do they diagnose is one, and second is who is the right person to go and consult is what we are looking at, because most of them are in psycho fear. Once they know that they are having something, they try to hide themselves, or they feel shy to share that they are being infected, and they are not really taking measures. And also this early prevention which can cure cancer is one which we are looking at. And I thank Rajendra Prasad Garu, convener, to organize this program. I request the convener to please introduce the speaker and take it forward.
Yeah. Thank you, ma'am. A very good evening and a warm welcome to one and all for today's evening webinar on cancer and treatment by Dr. Geeta Nagasree Garu. It's indeed my pleasure. I'm announcing this is the 6th webinar of from Women's Development, our HMA Women's Development Committee this year. And as a co-convener of HM Women's Development Committee, it's my honor and privilege to read the bio of our guest speaker for you all. Dr. N. Geeta Nagasree Garu is a senior consultant and surgical oncologist and associate clinical director at Care Hospital, Hyderabad and Vivekananda Hospital, Hyderabad. She's the founder of Avis Cancer Care Foundation even. Reputed to be, she's the first formally qualified lady surgical and gynecologist oncologist of the state. Dr. Geeta Nagasree Garu is an alumnus of Guntur Medical College and completed her MD from prestigious National Institute, Jipmar, Pondicherry. She finished her super specialty degree, MCH, Surgical Oncology, from the India's premier National Oncology Institute, Kidwal Memorial Institute of Oncology and Regional Cancer Center, Bangalore. Her training and work experience in surgical oncology includes several reputed institutes such as MNJ Institute of Oncology, RCC, Basavatarakama Indo-American Cancer Institute and Research Center, KIMS Hospital, Hyderabad, Research Center, Cancer Center, Trivandrum, and institutes abroad such as UMNCC, Nebraska, University of Illinois Hospital, and Washington University of Hospital. Her repertoire includes the entire range of surgical oncology, includes head, neck, thyroid surgeries, and gastrointestinal malignancies. However, she has a special interest in women's cancer, especially in gynecology, oncology, and breast cancer. She is specially trained in surgeries for advanced and recurrent ovarian cancer, including HIPEC and extensive peritoneotomies. She specializes in minimally invasive laparoscopic surgeries and breast conservation surgeries. She is a recipient of several international fellowships and awards, including Shingo Fuji Young Scientist Award, International Gynecologist Cancer Society Traveling Fellowship, and IGCS Travel Grant Award. She has received a commendation as an active member of IGCS and elected as the executive of the board of Association of Gynecological Oncologists of India, AGOI. She recently bagged the Times of Healthcare Achievers Award of the year 2017. As a rising star of the year oncology, she has been also felicitated by the several prestigious organizations and NGOs for her contribution to the society as a role of model professional. She has several international and national prestigious publications to her credit and is a regular faculty at national level CMEs. Her special areas of research include personalized medicine for breast cancer and recurrent gynecological cancer. She has addressed several CMEs with Telugu-speaking states as well as beyond. She is a regular contributor to the press, especially in the vernacular medium and oncologist health concern in both television and print media. Dr. Geeta Nagasree Garu is an active Rotarian and the Rotary Club of Jubilee Hills and is a member of District Cabinet and Regional Chair for Cancer Prevention. She is committed to the objective of mass screening of women's cancer, especially in the poor and underprivileged area of Telangana and Andhra Pradesh, and regularly conducts and directs camps for the same. She has worked with over 30 women organizations and the NGOs in this area. She can be contacted at Geeta Nagasree Garu at the rate of Yahoo at COIN and 990826839. It's indeed my pleasure, madam. It's very simple, but you did a tremendous contribution to the society and as an oncologist. Welcome you, ma'am. And the mic is yours. Yeah. Ma'am, mute. You're turning. Yeah. Yeah, right, fine.
Thank you, Rajendra Prasad Garu, for your kind introduction. Yeah, am I audible?
Yeah, very good, ma'am. Yeah.
Yeah, can somebody share the screen?
Yeah, Karthik, can you screen share it?
No, I also can share.
Yeah.
Huh?
Karthik, are you there?
Chinna.
Madam,
Can you help madam with screen sharing?
I've already made host, Madam, Geeta Madam.
Yeah. Can you share this?
You
One
find the
minute.
button share screen.
Yeah.
Oh, yeah, it's
Yes,
coming.
ma'am, we can see it.
Yeah. So you're able to see, ma'am. Yeah.
Thank you. Hello? ఎవరైనా మళ్ళీ చేస్తారండి, నేను మీటింగ్ లో ఉన్నాను. మ్యూట్ స్లైడ్ రావట్లేదు. We have a lot of myths about the modern medicine that the vaccines are not useful, especially during the COVID time. As India, at least better, so many people got vaccinated, but even in foreign countries like developed countries like US and almost half the population was not vaccinated because of this myth and all. And modern medicine is not useful. Ayurveda or some homeopathy is useful, and procedures are not done unnecessary for money. New modalities have not changed the life of the patients, and cancer treatments are withheld by the companies to be at more money. All these resistant bugs are circulated by the companies to market antibiotics. All this, there are a lot of myths and beliefs in the population, which is showing adverse effects on the population. It is very important that this we should put a curtain to these myths. So let us see what the modern medicine has actually done. So when we got the independence, can anybody tell what is our life expectancy? It is just a 45 years. More if those days most of us may not be alive. That is the life expectancy. Now even octogenarians are traveling abroad alone, not only abroad, they are going for a holiday. When it is almost 80, more than 80 life expectancy have gone to. So how this has increased? Definitely due to this is effect of modern medicine. Maybe research or development technology or development of good medicines, hygiene, everything has improved the life expectancy, not only in India, globally. When infant mortality has reduced, maternal mortality has reduced. You can see this picture. It is little bit chaotic, but what you can infer from this picture is those days, because so much of life expectancy so less because people used to die off because of lack of medical facilities and all these infectious diseases like smallpox, cholera, TB, lot of outbreaks used to be there, and malaria. All these infectious diseases used to harm the people, and most of the people die of these diseases at the young age. In fact, most of the kids never used to, almost 20-30% of the kids never used to see the first birthday. Those days, infant mortality was so high, and also in adults also they used to do of a diet young age because of these infectious diseases and lack of treatment for this. But we slowly, by this time we have, because of the advancement in that medical medicine hospitals. Lot of hospitals are there, medical facilities are there, and lot of good antibiotics have come. Everything put together, we have reasonable control over communicable diseases. But now the major bird problem, what is burning problem is non-communicable diseases. What are non-communicable diseases? Like these are the lifestyle diseases, like non-communicable diseases like first diabetes, hypertension, most of the people are having, then heart attacks, strokes, and cancers. People are dying. You yourself can know. Most of the people are dying of either of these causes. So most of these, all the common factor, whether it's cancer, heart disease, or stroke, diabetes, all the common factor is lifestyle problem, obesity, smoking, alcoholism, food habits, all these lifestyle all these, they are lifestyle diseases, which we can reasonably control if you have a good, healthy lifestyles. So in foreign countries, West and all, these cancers, each cancer was given one color, and that cancer day, like this is a breast cancer awareness month, this is a uterine cancer awareness day, like they celebrate so that to create awareness among the people. But India, it is still a multi-loaded truck. So what is a burden in India? 2.5 million cancer cases are estimated to be present in India. 8 lakh more than 8 lakhs. Now the figure has changed. Now more than 8 lakhs new cases diagnosed every year around India. And in India, 50%, more than 50% people are dying of, who are diagnosed with cancer. More than 50% are dying of that. Because of most of this is because of the late diagnosis. And nearly 15 lakh patients require facilities, and facilities are also not available. This, like if you see so many, if you see Banjara Hills, Jubilee Hills in area of 3 to 5 kilometers, we have so many cancer centers, like 10 cancer centers. And if you go to Northeast, whole of Northeast is not even having the cancer centers which are present in single Banjara Hills in 2-3 kilometers distance. So there is a lot of unequal distribution of facilities, health, medical facilities also. So this is also one of the causes. Nearly 15 lakh patients require facilities, and this dramatic increase in mortality and morbidity is definitely cause for concern for everybody. And rural and underprivileged population presents majority because of they don't have much access to all these facilities. So what is it? This is a growing burden of breast cancer. Breast cancer cases are rising in India, definitely. When survival rates trial in US and many women don't seek help until a mastectomy is their only option. Because that means it is advanced disease. So if you see this figure, in India, 5-year survival rate is only 52%. China, it is 82, almost it is 90%, 90% in US. So why in India it is so low? That means every 2 women diagnosed of breast, we are losing 1 woman of one woman of breast cancer. That is 50% mortality. Why it is so? Because of late diagnosis and negligence are part of Indian women, that they go for screening, they don't go, they don't go to the doctor when they have some doubt, and they just come in advanced stage, 3rd stage or 4th stage, where the cure is remote. That is a situation for not only the rural women, even educated women. Women, we have seen as educated as IAS officers or ministers coming in the late stage. They know some lump is there. They think that some other family members tell that no, it is that milk lump, milk secretion getting insipated. Something they tell that no, I also had that some time back, but their doctor told nothing. Nothing was there. Like these people, they take advice of other people around than the doctors, and they just get misled. They just come in very, very late stages. And these breast cancer cases are increasing day by day. The statistics are telling 1 in 28 women is likely to get breast cancer. 1 in 20, it is an alarmingly high figure in India. And the cause being that that breast cancer is not the disease for Indian women previously. Oh, it is we used to, once upon a time, they used to think it is a disease of the West. Breast cancer is a disease of the West because of the rapid change in lifestyles among Indian women, because we have adopted the culture very rapidly, westernized very rapidly. These changes are occurring and everything has changed in women's life. If you see, age of men, at least our generation, age of menarche is to the 14 years. Now it is 10, 11 years. Age of menarche has reduced. Age of menopause has increased. Age of menopause, 45 to 48, women used to get menopause those days. But now 52, 53 also women are menstruating. And number of children have come down. Everybody is having 1 children or no children or 2 children. Previously, those days they used to have 5, 6 children. Lot of children they used to have. And if a woman also, because of their career, everything, they are postponing their first childbirth and having children at after 35. And sedentary lifestyles. Most of the sedentary lifestyles, they are not exercise, they are not adopting to healthy lifestyles, and obesity, and also the pollution, what we eat, what we drink, what we breathe, everything is polluted. All this food contains, because this milk, all non-vegetarian food, everything is hormone based only. Hormones, they are putting artificial hormones and making them grow. So all these things, because of all these influence, the number of years of hormone exposure has increased. That is the reason this breast cancer and in general women's cancers like gynecological cancer, everything has increased of late, even in India, because of the westernization. Like you see, the peculiarity of breast cancer in India is, if you see this figure, this picture, like in Indian women, average incidence is 10 years less compared to Caucasian, means the white women. And proportion of high-grade tumor is also high in Indian women, and percentage of tumor that don't respond to hormone therapy also high. And incidence and percentage of younger women less than 40 is very, very high. It is 16% in Indian women, and it is only 6% in Caucasian white women. So, our Indian breast cancer genetics are totally different compared to the West. And so, moreover, this figure, middle figure, you can see breast cancer in India cases, deaths. It definitely 2008 compared to 2008 and 2020, it has increased dramatically. 1.5 lakh deaths per year in 2020. So coming to the cervical cancer, this is a picture of cervical cancer from the cancer registry from each city, and also the rural cancer registry of Barshi. And most common, it is cervical cancer is mostly the cancer in the rural areas with low socioeconomic women. And still, it is, in my opinion, that women should never get a cervical cancer. Means there is a 10 years of pre-cancerous stage where the women, one examination from the doctor or one pap smear in a lifetime will prevent so many women from getting this cancer. But sad part is, still in India, every 8 minutes we are losing 1 woman of cervical cancer. Is a very sad thing. Totally a preventable cancer. Cancer. And now there are vaccines also for the unmarried girls, which if you give vaccine, we can prevent them. Maybe if we, what I feel is, I'm really pushing the government. We are trying from our side, because if India can vaccinate 1.5 crore people for COVID, which is a great thing, it is not difficult thing to vaccinate this all eligible girls, teenage girls, for HPV vaccination. So, so if we vaccinate all eligible girls, teenage girls means before marriage for HPV vaccination, totally women will be free of this cancer in another maybe 2030. these are the various most common type of cancer in men and women, but 40 to 50% of cancers in men directly is identified. The cause of the cancer is tobacco. Tobacco is the most important identified cause of cancer and is responsible for about 40 to 50% in men and 20% of cancers in women. And India has an added burden of tobacco chewing, especially in the Telangana and North Karnataka. Even women has that habit of chewing tobacco that is called quid. They put in the betel leaves and put in the in the cheek. So the most common is oral cancers are very common in Telangana and North Karnataka because of the habit of chewing tobacco. Tobacco contains thousands of carcinogen agents which causes cancer. Now, people think only tobacco causes lung cancer, no oral cancer, not like that. Tobacco is a cause for all the cancers, right? From esophageal cancer to the women's cervical cancer, to stomach cancer, to pancreatic cancer. Most of the cancers, the bladder cancer, everything, all cancers are caused by usage of tobacco. Cancer is now one of the top causes of death in India after heart attack, up to 7th position in 2000. India has some of the world's highest incidence of cancer, like cervical cancer. In North, gallbladder cancers are very common because of the fatty food habits. Oral and pharyngeal cancer, as I told, the oral chewing of tobacco, which is also the most common. 70% of lives are snuffed out of the first year in India due to after the diagnosis. Within the 1 year, only 70% are dying of this cancer mainly because of the late diagnosis. Now the cancer, advanced treatment are there, good treatment are there. The only one and only key for the survival or success of cancer treatment is early diagnosis. 80% of patients consult doctors at the stage where the recovery is rare. 70%, 1% of deaths occur in the productive age band, like 60, especially these women's cancer, breast cancer, cervical cancer, affecting women in the productive years of life, that is 30 to 60 years, where women are very, like they have a very young family, children are very young, where women are the pillar of this family and they are useful for the family. Those days, these women are affected with this cancer are dying. So 15% of patients are children and young adults. And 50% of cancers are now due to the lifestyle changes. As I told, obesity, tobacco usage, all these are, most of them are lifestyle changes. If you see this figure, breast cancer, what is the difference? Breast cancer in India, 25, they have compared the study breast cancer in India, 25 years back and present. What we have found it from 25 years back and now, engaged breast cancer, below 50, especially below 40, you can see this figure, engaged breast cancers have dramatically increased. Younger the age and the tumor will be very aggressive. This is the incidence of cervical cancer in some of the worldwide. So you can see the Indian figure blue with the blue. So India is the highest incidence of cervical cancer, and 1/5 of the world's burden is in India. See, this is this thing. The 1/5 of the world's burden of cervical cancer is in, not 1/5, 1/3 of the world's burden of cervical cancer is in India. So once one foreign lady was doing some work in NGO work in India, I happened to meet her. She was telling, still 8 minutes, one Indian woman dying of cervical cancer is a nation shame. That's what she has commented, because it is a totally preventable cancer. And government has to take some efforts, but India is a vast country where we must address this cancer pandemic. India is a very vast country where we have a lot of problems, because budgetary wise it's a very low but small budgets for healthcare, and that budget also has to be shared from between all these communicable diseases, like now COVID has happened, so all health budget has to go for COVID. So all these non-communicable diseases will go aside. So it is not an easy thing to do screening for it is not an easy thing to screen every woman in India. Opportunistic screening was not there. It is only it is only the population based screening was not there. It is only the opportunistic screening. It is only the it is only the opportunistic screening. So people who want to get screened will get screened. Those who don't want, like after health education also, many people won't come out. Whenever I go to women organization, I tell that, see, Amma, nowadays we are not even getting one saree less than 3,000. Forgo one saree and get this test done. Many women's lives will be saved with especially breast cancer, early diagnosis. There will be more than 95% survival rate. And I even tell, if you have some inhibition, nowadays every woman is in some group or other group, like HMA group or kitty group. You put one thing as a health kitty or health week, and everybody go and get as a fun, you go and get screened. So nothing is there is good, something is there, it is diagnosed very early, so that so many lives will be saved. So we must address this pandemic, definitely. So government has its own first developed its statement on cancer control. What is the government? Let us see what is government doing. As early as 1971. So cancer control program was revised in the year 1984, and it has established 21 regional cancer centers, and it has upgraded some of the medical colleges to the regional cancer centers. So lacking direction of prevention and early detection is lacking in India. Studies have documented lack of awareness and screening for cervical carcinoma in India. Studies have documented lack of awareness and screening for cervical carcinoma in India, and there are no organized screening, as I told, and awareness program for any of the common cancers in the country. Most of cancer centers provide only opportunistic screening services. Common challenges to cancer therapy in the developing world, like India. Asymptomatic conditions receive little attention in day to day. If a woman comes, Ma, you have such a big lump, why have you not approached doctor till now? It is not paining. It is not causing any harm to me. So that's why I neglected, they tell, because asymptomatic. Most of the cancers are still the late stage, are asymptomatic. Though there is a lump, though they have bleeding, everything they know, harm is not causing pain or any. That's why they neglect. So competition with competition with infectious diseases and other health needs for limited resources of the limited budget. Educational, and there are a lot of barriers, stigmas in India, educational, religious beliefs, and economic barriers in India. Underreporting in the absence of standardized, there's no proper cancer registry everywhere. Even both the Telugu speaking states still now is not having proper cancer registry. We don't know the proper instance of cancers in Telangana or Andhra Pradesh. We are not having proper. Recently NIMS have started cancer that is only hospital based cancer registry. Population based cancer registry is still not available in our states. Infrastructure must be available for transport. If some tests are done, also infrastructure should be available for transportation of sample to the high quality labs for processing and interpretation. Shortage of diagnosis and treatment centers often requires women for positive skin tests to undergo biopsies and treatment at distant health centers, which require patient to travel repeatedly or extended. Because these, especially in the rural areas, these women lose. They think they lose. Women are attendant. Our husband lose their daily wages if they come to the cities or where the tertiary centers, healthcare centers are there for diagnosis, and these are not the diagnosis which happens in one day or one few hours. It takes some time, so they repeatedly have to come, and they lose it. They lose interest, and they just neglect themselves. Lack of computerized database to facilitate the follow-up of it. We don't, and if some patient comes, we know it is cancer also. If they go off, nobody follows them up. Nobody calls them that you have a cancer, you come back and undergo treatment. So follow-up is also not there. So screening, what is screening? Screening used to detect cancer before person has any symptoms. That is known as screening. There is certain criteria for screening. For every cancer is not amicable for screening, because that should be useful. That should diagnose early, and that should reduce the mortality. It should reduce the mortality. Helps to detect and treat pre-cancers and early cancers before they have a chance to spread. This screening. So breast, one of the best modalities for screening is, example is breast cancer. Breast cancer, it has proven in many studies that it has reduced the mortality in the population if population undergoes screening, regular screening. So women has to undergo mammography with ultrasound breast every after Indian women. This is American Cancer Society recommendation is 40 to 44 to choice. They should start with doctor and start annual screening. But India, compared to the West, India, the incidence of breast cancer is at the young age, 10 years less than the West. So we should start our screening from 40 years onwards, definitely annual screening. And 55 a year and older yearly, or some no very low risk, we can 2 years, but better to always in breast, I say that it better to do yearly mammography, because people have a lot of myths in this also. They think that it will get there is a lot of radiation. Nothing, no radiation, very small amount that we even in the our day-to-day basis, if we are going in the we are traveling, we are in the environment, that much exposure we have for the radiation. So that is a very negligible risk. And any investigations in the medical field, if you do, we have to weigh the risk versus benefits. If benefits far outweigh risk, we can go for that investigation. In this mammography, benefits far outweigh the risk. So that radiation exposure is not a risk. So better the women undergo regular annual mammography. Screening in the breast should be considered as long as woman is in good health. So all women should be familiar with the benefits, limitations, potential harms linked to the breast cancer screening. So I already explained that people ask that radiation exposure, no mammography, nothing. The benefits far outweigh the risk, so we can undergo for the screening. Women should, and moreover, women should be breast aware. They should know the familiarity of their breast. That way, if anything abnormal, they should be able to recognize very easily. Women with family history, genetic tendency, or certain factors should be screened with MRI breast. MRI is more sensitive to the than mammography. But for everybody, we don't do MRI. If they have family history, they can undergo MRI. And family history nowadays, that after human genome has been decoded, there is people have family history. That is if 2 generations, or if you like mother, sister, or paternal side, first cousins, 2-3 members in the family has this breast cancer or ovarian cancer, definitely the other family members are at risk. Now that with a simple blood test, they can find out the gene for that hereditary gene, and if that is comes positive, these people are also at risk, so that we can do risk reduction surgery. Like if after they completed their family, we can remove both ovaries. And some, like Angelina Jolie has undergone bilateral mastectomy and reconstruction. If they want that, we can do bilateral mastectomy and reconstruction also. Or if they think that is a extreme step, we can give some tablets and screen regularly every 6 months, yearly one MRI and one mammography. Every 6 months we alternate, so that if anything is there, it can be diagnosed very early. The cervical cancer screening should start at 25 years, and 25 to 60 HPV test can be done every 5 years. Co-test with pap smear also can be done every 5 years. If you are using without HPV DNA test, only pap smear, it can be done every 3 years. People over 65 can discontinue screening the last 10 years if their pap smears are normal. People who are vaccinated should also continue screening because vaccination has only 95% protection rate. So endometrial cancer at the time of menopause, when it comes for regular, all women should be counseled that if they have any menopause, post-menopause, any bleeding or any spotting, they should report to the doctor very immediately. So that because it's the signs of endometrial cancer. Colorectal cancer, like regular screening, it is the men and women disease, regular screening at age 45. Stool for occult blood can be done. If the 3 consecutive samples, one or any one is positive, they can go for colonoscopy, or otherwise colonoscopy can be done every 10 years. It should be continued till 75 years. This colorectal cancer is most common is more common in West than Indian women because Indian diet. Recently, somebody has in paper, some paper has come, sambar has a protective effect in colorectal cancer and all. And all our spices, our diet is a very fiber-rich diet. Because of that, we have definitely protection against colorectal cancer. Compared to the West, we have less incidence of colorectal cancer. Lung cancer, especially for the smokers, it is better. Lung cancer is the most common cancer in males, in Indian males. So low-dose CT scan, they can undergo yearly low-dose CT scan. 50 to 80 years old in fairly good health, they are smokers, or they have quit the smoking 15 or 20 years back. They have smoked and quit the smoking also. They are at high risk for lung cancer. They can go low-dose CT scan. Those who are at least 20 pack years smoking history, they should undergo low-dose CT scan. Prostate cancer starting at 50. There are pros and cons to be discussed with this prostate cancer. This PSA test and rectal examination they do. If they have family history of prostate cancer, it can start at 45 years PSA test for men. So these all help to reduce your cancer burden. Stay away from all forms of tobacco, any form of tobacco. Get to and stay at a healthy weight. BMA should be ideal BMA. So get moving with regular physical activity. Eat healthy with plenty of fruits and vegetables. Stay away from alcohol. If they want to have alcohol, they can have in limitation, moderation. Know yourself, your family history and your risk factors should be well known by the individual so that they can take steps to prevent them. Get regular checkups and cancer screening test. The only way we can reduce the burden, not only on ourselves, burden to the society and world, cancer burden. So cancer, we are only not we as a doctors or cancer specialist, we are not only the brand ambassadors. Every individual should be the brand ambassador for the cause. If you have knowledge, you should educate more people about the cancer screening so that especially in India, only this way we can reduce our burden because we don't have a population-based screening. But India is a poor country in the budgetary wise, but we are very rich in human resources. Across length and breadth of the country, we have so many ASHA workers and ANMs, they have the access to the last reach of the last house of the country. But government should utilize them in a proper way, guide them, educate them in this screening so that at least we can reduce the burden, very fast growing burden of cancer in India. What are the symptoms of the cancer? Breast, any lump or any firm feeling in the breast or underarm, any nipple discharge, reddish discharge or serous discharge, or skin that is itchy, scaly, nipple retraction, puckering of the skin, they should go to the doctor. I'm not saying every lump or all these symptoms are 100% cancer. If their lump is there, also only 20% lumps are malignant. Rest 80% are benign only. But we should every lump should be viewed with suspicion unless proved otherwise. We should prove beyond doubt it is not a cancer. We should not take any risk. So bladder troubling, urinating, and pain while urinating, blood in the urine, all are the symptoms of bladder cancer, or any pelvic mass which is pressing on the bladder. Bleeding or bruising for no known reason. When platelets are less in blood cancer center, it happens. Bowel changes, blood in the stool, change in the bowel habit, constipation, diarrhea, alternating constipation in diarrhea, all these things, bowel changes. Cough and hoarseness does not go. Cough and hoarseness are common with the cold and respiratory infection, but that will 1 week it will be subsided. If it is not subsiding for 1 week or 1 month, it is not subsiding. Cough, you definitely had to go. It should be addressed. You should go consult a doctor and get the investigations done. Eating problem, pain after eating, persistent heartburn or indigestion, trouble swallowing. You're not able to take solid food. Everything you swallow, you have to take with the water. All these are signs of esophageal cancer. And belly pain, stomach, nausea, vomiting, early satiety. If you eat little, your stomach will be full. These are all, even ovarian cancers, all these symptoms will be there. Early satiety, bloating, pain, all this, appetite changes. Fatigue, that is severe and lasts. Fatigue, undue fatigue will be there. You will be normal, but you're not able to bear, very like you'll be asthenic. Fatigue will be there, and fever and night sweats. In this Hodgkin's lymphomas and all, you'll have fever and night sweats. Mouth changes, white patches, or ulcers in the mouth, inside the mouth, which is not healing. All these oral cancers. Neural, sometimes all, if in metastasis stage 4 and all, if bone in brain cancer, head and neck, headache, seizures, vision changes, hearing changes, drooping of the face will be there. And skin changes, non-healing ulcer, any jaundice, everything should be addressed. Swelling or lumps anywhere, underarms, neck swelling. Sometimes neck swelling may be due to thyroid. Thyroid may be due to lymph nodes. The lymph nodes may be lymphoma or tuberculosis, or maybe due to head and neck cancers. It can come to the neck or groin or abdomen. Any lumps, weight gain or undue weight gain or weight loss with no known reason. You're not unintentional weight loss is also a problem. So all these are the symptoms. What is the cause for the cancer? Genetics, we have heard some are hereditary. Only 5 to 10% of some cancers are hereditary. Rest all sporadic. But genetics loads the gun, and environment pulls the trigger. Most of these cancers, I always say, cancers are nothing. What is cancer? It is our own cells dividing uncontrolled way. Nature is so perfect that in cell division, there is some 2 genes which control this cell, tumor suppressor genes and proto-oncogenes. There is a perfect balance between these 2 genes, that cell division is so smooth. If in these genes, if one of these genes acquires some mutation, that mutation may be hereditary to the genetics, or it can be environmental factors like pollution, smoking, pesticides, anything. This environmental trigger, then mutation happen in these genes, then this balance will be lost, and they start dividing uncontrollable way. This uncontrolled division only is known as cancer. That tumor, that can be benign or malignant. Benign will stay there only. This malignant tumors has a propensity to spread to the other places. So what do you think? Rapid increase in cancers in India nowadays. As I told everybody, we went in 10 years where US, westernization we have adopted. That is correct only. In US, they have adopted these changes to happen. They took hundreds of years they took to get these changes, because we adopted those changes in very rapidly, 10 years only, which they adopted in 100 years we have adopted. There's a reason, there's a compression of all these risk factors, maybe the cause of very high burden increase in the cancers in India. So change of paradigm, there is definitely a paradigm shift in India. So we should again take healthcare back to healthcare, not disease care, because we should concentrate on our lifestyles and prevention rather than treating the disease, which is really a heavy burden, treating the disease. So realization that disease and health are lifestyle choices we make for ourselves, we should realize. So how well are we geared up with this challenge? Definitely we are not geared up. So everything revolves around people, process, and technology. All these three are very important for us to do anything. So if you, anything, any news, if you tell, nobody accepts that. First denial will be there, then anger, then bargaining, then depression, then the acceptance start. Any change, any new change, or any diagnosis, if you tell that people, the person, the patient, that you have this cancer, means then they tell, no, 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 why will it happen to me? It won't happen to me. I maintain very healthy lifestyle. I do exercise, I do yoga, I am vegetarian, and all they tell. And then anger, why should it happen to me? So I am so disciplined. Then bargaining start, then depression, then they accept the fact. This is the way it happens. So when the diagnosis happened, I already told treatment, technologies have grown, treatment is not the issue, everything is there. Only key to the success is early diagnosis, and early diagnosis, not to neglect, and get the regular screening test done. So treatments, no need, if at all patients is diagnosed with after maintaining all life like healthy, not like that if they maintain healthy, it won't happen. Sometimes it can happen. So if at all you diagnosed with cancer, no need to get fear, no need to be feared. So nowadays treatments are less and less invasive. Previously, once upon a time, few decades ago, if a woman has a breast cancer, they used to remove whole breast and above the muscles above the chest, and that hand used to be swollen like this, and so much morbidity and mortality. But now we are not even removing whole breast; just we are doing the cancer part with the normal tissue, that we adjust the breast like other breast only. So morbidity is all less and less. In surgical treatments are more precise nowadays, and morbidity is less. Anesthesia, pain relief, everything has improved over time. See, I told no breast. Previously, it used to be like this. They used to live whole breast with the chest muscles, and they used to have swollen hand like this. But nowadays, we are just removing. Say, this is nowadays how you do it. It's small incision, remove the tumor with the normal tissue, that tissue, and the whole breast remains like that only, with less morbidity. Women will be, I mean, they like, it is like they have just undergo treatment and they lead a normal life. So these all minimally invasive surgeries have come, and we are abdomen surgery, most of uterine surgeries, and we are not opening up unless necessary. We are doing laparoscopically, and so that women can walk and stay to 1 or 2 days hospital stay, they can go home comfortably. That incision pain will be less and all. So all this treatment, even chemotherapies and all, targeted therapy has come. Side effect, good medication for side effects have come, and radiation also more precise. Previously, if you give radiation to the breast, chest wall, that back, heart, lungs, everything normal tissues used to get affected. But now, no. We only to that part it is a very minimal dose to the normal going. And immunotherapy has come where, and we even taking the cells, tumor cells out of the body, growing antibodies against these tumor cells and injecting these antibodies back so that it fight with the tumor cells, so that tumor cells will be destroyed. So immunotherapy. So science have advanced a lot. No, there's an era of personalized medicine. Like we have our own outfit. One person's outfit won't fit others. So no two people are alike. Why should we be treated the same? Treatment is no longer one size fits all. It should be individualized according to their genetics, because now the human genome is decoded. Like when mobile phones has come, even incoming charges, they used to charge 20 rupees a day. Some cost will be there. Now with 200 rupees, n number of calls, thousands of calls can be made like that, because it is now only genome has come. After some time, this rate of genetic tests also will definitely come down, and definitely we all will have our own genome genetic profiling, and according to our genes, according to the tumor genetics, we treat. So it is a way of personalized treatment, so that everybody will, the results will be good. Treatments are now tailor-made for the patient in accordance to their disease and the conditions, expectations, compliances, fears, and cultural beliefs. Everything we had to take into consideration and treat the patient. So this is like I told the personalized medicine. There's a group of patients, one group of mixed group of patients where we use some drug, some chemotherapeutic drug. For one group, drug is toxic but beneficial. But other group, drug toxic but not beneficial. It's a very bad. It is not toxic but not beneficial. Toxic but not beneficial. Drug not toxic and beneficial. This is good type. But drug not toxic and not beneficial. So it will, if you give one drug, different groups, it will act differently. So if you see their genomic signature, if you do every individual genetics and give accordingly for everybody, drug will be less toxic and will be beneficial. So that it benefits more people. It is like this cancer patient with colon cancer. So therapy. For one, there will be effect of the red, no effect, and for adverse effects for in this group. If you have cancer patient, if you divide according to the genetics, so that everybody will have a good effect. This is personalized medicine, treating, individualizing the patients and treating. So with all this technology, where we are lost. So one focus should be there for a clinician always is like we have CT scans, we have PET scans, everything is there, but clinical examination is clinical examination. We should not miss. Nowadays, doctors are not putting hands on this. Personal touch is not there. They just depend on the CT scan. But clinical examination is, history is very important. We get so many points from the history, talking to the patient and taking the history. Just doing the investigation and treating the patient, we are likely to miss so many things, and we are like, and patients, there's a harm for the patient. So we should never forget that history and clinical examinations till the gold standard, whatever, all these things are only complementary to what to the history and clinical examination that every doctor should remember. So nowadays, patient comes with the Google doctor. You tell they Google it up, everything, and come. So patient comes with the knowledge, doctor for the insight and wisdom. So every doctor we feel it is not only doctor,
Madam?
it should be doctor.
Hello, good evening, madam. Kindly intervene. This is Nagesh. It's a good session. I want to ask a few questions. The treatment of cancer was choice of treatment is dependent what factors you level it. As you said, immunotherapy, and apart from that, you said good thing that is genetical mapping and all. How so? My question is
First examine the patient relevant. First, we examine the patient. Relevant investigation will be done. Then we'll decide whether patient all modality. Cancer means multimodality treatment: surgery, chemotherapy, radiotherapy, all for solid tumor. Unless it's a stage 4 cancer, other stages multimodality treatment. We will decide where it fit, where this stage, this condition of the patient, everything we take into consideration, whether to go for surgery first and then go for chemotherapy later, which is a gold standard, or if some situations, advanced disease is there where we can't do surgery upright, we go for chemotherapy first and go for surgery later. Like that, we examine it. It is no two patients are alike. Each patient we should individualize, spend for some time, discuss with our colleagues, which is because of multimodality treatment, discuss with our medical oncologist. I'm a surgeon, I discuss medical oncology, radiation oncology, which is the best treatment for the patient, and decide the plan for the patient. It should be individualized, not the common, okay, this patient had that, not necessarily the other patient will have the same treatment, diagnosis and same type of tumor. So this patient we have to individualize, and what is best for her, we have to think and treat the patient.
Based on the madam, you are saying that the screening is dependent upon based on the type of symptoms and all. You are telling that based on the examination.
No, you are not understanding. Screening is different. Screening is the thing we do for normal patient, healthy patients, sir.
Okay, madam. You are saying that.
Yeah, I think we have investigation. Hello. We'll have questions at the end of the
questions in the chat box also.
Yeah, we'll have questions.
Okay, continue.
Yeah, every doctor
fine.
should.
Sir, I have given a chat box also.
Okay,
ma'am. Continue, madam. Thanks for.
every doctor should be doctor scientist. So we should go, then only we can able to deliver the good results to the patient, going back to the ancient roots and interpreting the traditional wisdom in the light of science. In the light of the science, we interpret all. We should, like, if our patient comes and tell that, madam, they are taking shimoga medicine, they are taking ayurved medicine for cancer, any type, I always tell that I don't discourage them. I also, not instead of this treatment, discontinue this treatment. If you take that alone, there will definitely harm, this cancer will grow, that won't work. You have belief in that, take this treatment. Along with that, if you want, you can take that treatment. We usually advise like that. I usually advise that. Incorporating traditional, parallel, and non-conventional modes of healing and treatment. So your patient is a center, that you should consider all these things. These are the multimodality treatment. For if I'm a surgeon, if I just concentrate on surgery, patient won't come out very well. I should concentrate for everything. Surgery, first diagnostic modalities, patient relationship, doctor patient relationship is very important. Care of management, diagnostic imaging, surgery, chemotherapy, immunotherapy, all these revolve around the patient. And then mind body medicine, spiritual support, rehabilitation, pain management, nutritional therapy, everything is a part and parcel of the treatment. Okay, I just cut, just leave the patient. That won't do, that won't help, that won't bring the patient out. We should concentrate of everything, right from the nutrition to pain management to rehabilitation and spiritual support, everything we should, if you give only, patient will come out very well. So it is integrated medicine wheel, patient in the center. All these revolve around the patient, lifestyle, behavior, mind, body medicine, manipulative therapy, surgery for drugs, chemotherapy, herbal medicine, if they want nutritional medicine, therapy, everything revolves around the patient. So it is a multidisciplinary, it's a multimodality treatment, and a multidisciplinary team has to discuss and treat the patient. So, but challenges do remain in India. Women, the center of the family, not only India, globally, of the family, but rarely puts herself on the focus. Neglect herself, take care of everything, family, husband, everything. She just neglect her health. That is the reason most of the women are, not only women, men also. In India, the late diagnosis is very common in India. Rarely focus on herself. And women always work. Women with breast cancer also, she does all the work. Men with, these are just a slide. So at the one end, we have a lot of parodies. Like in the West, at the one end, this, you can identify this picture, Angelina Jolie picture, because her mother and grandmother, they have diagnosed with cancers and they have undergone treatment. She has seen the turmoil, what they have faced. She has literally seen it. So because of that, it is that time there's a lot of debate in the TV, and also the mastectomy rate, prophylactic mastectomy rates in US has increased dramatically after Angelina Jolie has undergone her bilateral mastectomy prophylactic. So it is definitely her personal choice, because being a Hollywood actress, she has taken the extreme steps of removing both the breasts and reconstruction because of the personal. It is her personal choice, because she has seen her mother and grandmother suffering, so taken that decision. And reconstructed, removed her ovaries, and risk reduction. She has reduced risk for herself because she is also BRCA positive. World has advanced. What one end is that even genetic testing prophylactically we make, and doing risk reduction surgeries. And this is the picture when I was in MNG I have taken. This is the mother. She's hardly 30, less than 30 years, and her young daughter, like 7 to 8 years, from a rural Telangana. And she had a cervical cancer advanced stage, which 3B also, which sometimes they don't, all the cancers won't respond to the radiation or chemotherapy. Some there are resistant bugs, the tumors are resistant. I think And after giving radiotherapy and chemotherapy also, that cancer has not responded. And we even tried, because sometimes if it is not respond, we do exentration, remove everything, bladder, bowel, uterus, whole pelvis we remove, clean it up and reconstruct that ureter, we put in the bowel and put it outside, reconstruct bladder and stoma outside for motion, 2 stomas for urine and motion. That also we did. That is also not possible for this patient because it's so advanced. So this such lady will succumb to that, might have succumbed to the disease in next few months. And that girls in the rural areas, because cervical cancer is a low disease of the low socioeconomic group. So these those in the low socioeconomic groups, such young children will become orphans later, because nobody takes care of them. Later they become antisocial elements. So in the Lancet, one article has come. This cervical cancer in these developing countries is not only the family problem, it is the community problem. It is a social problem, because all these people in this low socioeconomic groups, these children will become orphans, and they become antisocial elements tomorrow. So society is now well aware of what is happening. So we are well aware of what saree we wear, what earrings we put, everything external. We give so much importance to the external, what we wear, what external importance, but none of us are bothered about what is happening inside the body, fashion, accessories, and company we keep, the people we see. We are all very particular about what, pay little attention to what is happening within. So women should concentrate at least. Because women has achieved everything so much. They are competing in every field, but at the same time, with the stress, doing the work at home, doing the offices, they are neglecting themselves and succumbing to all these diseases. So should concentrate on themselves and get the regular yearly screening. One day they should concentrate for themselves and get these tests, and so that so many lives will be saved. That's what I want to give the message. And I will fight this cancer. Not only women, men also should concentrate on their health, especially weight maintenance, healthy lifestyles, exercise, eating in moderation, avoiding tobacco, alcohol. All this is very important to prevent both heart attacks, because at least for women till menopause, there is a protection for heart attacks. So many men in their 40s we are losing them because of heart attack. So diabetes, hypertension, all these things. So men and women, they should concentrate on their lifestyle, adopt the good healthy lifestyle, eating good food containing a lot of vegetables and fruits, and doing regular exercise, maintaining ideal body weight, getting these checkups done every year, at least yearly, cholesterol, sugar, BP, all these tests done every yearly, and maintaining this healthy lifestyle, so that all these things, cancers, heart attacks, everything, all these lifestyle non-communicable diseases can be prevented and avoided. Thank you. Just not add just years to life, but life to the years. Thank you. Now I'll see the chat box.
Yeah, thank you, ma'am. I think we have some questions in chat box now. I'll just read that. I think the one person is asking about that, madam, lack of awareness, change in lifestyle lead to cancer. And same thing is asking another question on, madam, usage of plastic in food storage, how much directly contribute to cancer? Again, same question from him. Another question from him. Madam, lot of carcinogenic are present in materials of skincare products.
Actually, all these food means when we are showing plastic, food grade plastic is little bit okay. They are all manufactured after this. All these rules are there. After that, food grade you can use if you want to use plastic. And these cosmetics and also all these, if you buy from the good companies, they are all regulated only what they are using, especially. Yeah.
Ma'am, like, you covered, like, how to go about the total protocol of the process of cancer when they come across with some sort of a symptoms, then how they have to go for a protocol.
Symptoms, you have to consult a doctor, you have to consult a proper, most of them, what they do is, if a breast lump is there, first they go to the gynecologist. They also don't leave the patient. They do some surgery. They just meddle with it. Some they excise the lump and they again come to us. Then we have to do another surgery. And also sometimes, with that meddling and all, they lose chance of conservation of the breast. We may have to remove the whole breast and all. So first itself, if you properly consult the first itself is consult a proper like as breast specialist or oncologist is better. Sometimes also in women with postmenopausal bleeding, they go to the gynecologist. They do surgery, and after surgery, it is diagnosed as a cancer. Again, they come to us. They have to, at that age, they have to undergo one more surgery, 2 surgeries. So first itself, they consult a proper persons. These things can be avoided.
Okay. What should be the role and responsibility of attendees, ma'am? Like, for example, a attendee, like, for example, a lady is got in the house, she got it. So how to support that mechanism of.
Support is very important, especially in India. We don't lack that because most of the in Indian patients, there's a lot of support from the family, especially husband, children, extended family, parents, or in-laws, or sister-in-laws, and we do have, most of them have a lot of support, and that is very important. And women are not only support, that it is depend on the attitude of the patient also. They should, the women, those patients which have the positive attitude will do very, very well in this cancer treatment.
Yeah. Okay. Thank you. Any insurances are there now? Like insurance?
Not only that. As in our foundation also, we have a support group, cancer support group. In West, cancer support group is very prevalent because they don't have support from the family, and those who has undergone treatment, they form a support group, so that, and not that in India also that is useful, because especially women, when they have young children with breast cancers and all, in 40s, they are 40s, when their children are teens, if they are diagnosed, they are very depressed, because if they cancer means, if they hear that they think they lose their life, and if they lose their, what will happen these to children, that thought will be there in the women. So they'll be very depressed. How much we counsel a lot. As a doctor, as a primary physician, as a surgeon, I have to counsel them. I take some time and counsel them that nothing will happen these days. This is also like any other chronic disease, like hypertension or diabetes. You will get over it. Only thing 6 months, there's a temporary like discomfort. We counsel a lot, but more than our counseling, the patient who has undergone already treatment, call them. I give their numbers. If they call them and if they talk to them, some people really has undergone treatment. They have foundation. They really do a good job. They counsel. They even come to the hospital. They even go there to their homes and counsel the patients as a social work. So if apart from our counseling, if the patient who has undergone already treatment, if they counsel them, they will really feel very comfortable.
Okay, great.
So this cancer support group also is very important.
Oh, great. Achha, I request Ramchandra Garu. Hello.
Yes, Mr.
Achha, sir, I think you can take it up, sir. Closing remarks and vote of. I request Ramchandra Garu to take up the closing remarks and vote of time.
Thank you, Mr. Prasad. It's been a very interesting talk today by Dr. Geeta Nagasree. The topic is really the most important, cancer and its treatment. Everyone is very, very concerned about this, mainly because people have so many fears on this. And I think doctor has taken a lot of pains to talk in a very simple words, how to take care of it, the myths associated with it, the alternative treatment people go for, and all these things. I think she has explained it very well. We all know that we always used to say this is probably genetic or hereditary, and somebody in the family is there, you also likely to get it. So, I mean, this has been the common talk, but you can also see the impact of today's the environmental conditions, the pollution levels, the high use of pesticides. Somebody was mentioning about the plastics also. All these things, I think, have added more to this danger. And we are inviting cancer more. I mean, please, I mean, that sort of invitation is being given by our wrong habits. No wonder today the world is arisen to this. The concern regarding environment, I think, is at highest level. The several protocols, starting of Kyoto Protocol, the latest Paris Accord, and all that. Everybody talks about how to really make this world to live, make it livable. And these sort of problems, I think, should be really be eliminated. And I think Dr. Garu has wonderfully brought out all these aspects. She explained the various facets of it and how we really can probably be careful. She has been very, very strongly reiterating that the initial care is very important. Initial evaluation, initial reduction is very important. And she has given a number of steps how it should be done, especially the women folk who are probably having higher incidence, apart from the other men also. But she has given very clearly the steps everybody should take and take it to the side rather than get frightened of it. Because once you try to close your eyes to the problem that probably sometime it is really coming, I think we'll not be doing any sort of justice to it. And early detection will definitely give a lot of cure. And this basically, as rightly said, in the rural areas, awareness is low. Even the government has to step up. She is right in her words saying that government need to step up and then try to spread more. Like she also gave the example of today's COVID, the vaccination that was done for nearly more than 140 crore people. And all these things, when government can do that, this also can be done in a more systematic way, right from the primary healthcare centers in the villages, trying to explain to them various things. That probably is the right probably suggestion she has made. So I strongly believe that what she said is very right. And I think she's the expert in this, a very seasoned oncologist. She has seen people suffering. She has seen people how they came out of it. And finally, the answer is earlier, take care early and then see how we get going. And then probably all the patients who really suffer also need a lot of care and support, which I think she has also rightly enunciated. So I thank you, madam, for this wonderful talk. It has been very simple word. I don't think that you have used any complicated words, and every one of us understood it very well. And it has been a very learning experience to many of us who are sitting across. I thank you once again on behalf of HMA. I thank the participants who have sat down today. More than 50 participants are there, and they have very much keenly listened to the talk given by Dr. Garu. I also thank our President Kavita Garu, who has made it possible to attend today's meeting despite our hectic schedules. She's always standing behind the women. She's our women president, and she always supports such type of cause. I also thank Mr. Rajendra Krishna Prasad, who has brought this interesting topic. It is not a question, it is a management. I would rather say it's a subject related to management. How you manage yourself, how to manage yourself not to get the cancer, and if at all somebody gets affected, how to really manage it and get out of it. So there is a great amount of management in this. I also thank the background staff, Geeta ji, Brahmani ji, and again today we had a wonderful, uninterrupted session technically, and I thank Mr. Karthik, our technical person behind this. So on behalf of HMA, I once again thank one and all, and I'm sure we have a good takeaways at the end of today. Namaste.
If you have anybody has any doubt, you can. I have put my number in the chat box because women never come out with doubts in open. Later they have a lot of doubts and about their health and this thing. Later they'll come out. That's the reason I have put my number in the chat box. You can take my number. If anybody has any doubt, you can approach me. You can WhatsApp the same WhatsApp number, or you can call me anytime.
That's very unusual, Dr. Garu. Your doctors are normally very busy, not accessible easily, and I'm very happy that you have given this number and your WhatsApp number also. And I think we thank you once again on this nice gesture of yours. Thanks.
There's a lot of doubts, and even educated, they never come out in the open. They afterwards they really have. Sometimes I have seen few incidences, and that's why I am doing this. Sometime we see it, we will answer.
Very nice.
Yeah.
Karthik, you can close.
Yeah, thank you very much. Yeah.
Namaste to one and all.
Thank you all. Good night, everybody. Closing the meeting.
I'll share that